Welcome back. Many people don't realize that there's more to dental care than making sure you have a beautiful smile. Joining me now to talk about healthy gums is Dr. Artemis Adkins from Adkins Dentistry. It's good to see you.
Thank you. It's good to be here.
You know, we just want our teeth to be white and have a great smile. And it's like all that other stuff we don't, but it's so important. Gums are huge. And if you know somebody who's been through some problems, you know why it's important.
Yes. Yes, you have to have, the foundation has to be there before all the rest of the stuff follows suit. You can't just have the beautiful smile. It won't stay beautiful if you don't have the, you know, the underlying stuff to go with it. So
exactly. What is gum disease exactly? Like, what is it? I mean, some people think you have to wait till you have all these issues, but really there's early signs.
No, actually, yeah. Gum disease is basically a periodontal infection. That's what we call it. It's a bacterial infection in all the supporting structures around your teeth. And in the U.S., if you were to step out today and look at everybody's mouths, you'd find half of the people have some form of the disease. It's a lot of people for a preventable and a basically treatable disease. No excuse why half of us are walking around with this disease in our mouths. It's statistically preventable and treatable. Unfortunately, there is a little bit of a disconnect between us professionally and our patients. Either they don't quite understand it or we're not doing a good job explaining it, but there's a lot of us still walking around town with the country with disease in our mouths.
Is that because it's genetic, because we just don't realize it?
You know, there are a lot of, we know more and more obviously as we go. Right now, they're finding basically links between it and heart disease, obesity, diabetes, osteoporosis. They're even finding links between it and some respiratory conditions like aspiration pneumonia and things like that. There is a genetic component, I have to tell you. If you have the genes for it, you're probably about 30% more likely to get it. That I fall into that category. It's still preventable and it's still treatable. So it's not that, thank God, it's not like some of the conditions where you get it and, oh, well, there you have it.
Right.
Which is one of the reasons why we so strongly, at least in our practice, kind of push the issue of prevention, push the issue of education. The more you know, the more you can kind of take care of yourself and not walk around with this thing that ends up, you know, this is treatable, but you can't live without your heart. You can't, you know, you can't have a stroke and live a normal life. So you got to start early. You got to start at the basics.
Yeah, and I think that's what a lot of people don't think, how it can lead to other things. Yeah. And you said it's also important. I mean, get the kids in. The kids are going in earlier and earlier, which is a big step.
Absolutely.
What are some treatments though to gum disease?
You basically, if you're on a maintenance program that you're regularly going to your dentist, we will look at you. Every time you come in, we look. Every time we evaluate. And as soon as you start showing, if you start showing ever signs of periodontal disease, then we'll get you basically treated, whether surgically or non-surgically. Non-surgically is the more common way initially. It's first initial therapy that we put in. And usually, I have to tell you, about 8 out of 10 times, that's all you need. And then you go back onto maintenance at that point. Sometimes you need you have more severe disease or more aggressive disease, in which case we'll talk about some more options, surgical options and things like that to help people. But it's funny because I always think about it, and I think for some reason our tolerance towards this disease has gone up for some reason, maybe because half of us have it. But people come in and go, yeah, I sometimes bleed. And I go, well, if I was sitting here talking to you and my face started bleeding, wouldn't you think it was a little bit odd?
Yeah.
But your mouth, your gums bleeding, and you're going, yeah, sometimes it's all right. I'm like, no, it's not.
No, and I think that they don't realize that if you're flossing and there's lots of blood, it's probably not a good thing.
That's not normal. There are things you can look for. Bleeding gums is one. Puffy, boggy, kind of tender gums is another one. Unfortunately, sometimes it can be kind of a silent disease, so you don't always know you have it, which is why the prevention. Go regularly. Yes. Come see us. Go get on the program. So
very important. Thank you so much. Thank you. That's great information. And if you do want more information, you can go online to AtkinsDentistry.com. There's the phone number right there on your screen. Thanks again.